Hey there, you're riding in the car with the Chiro. So today I want to talk about quote unquote health insurance. A lot of posts going on amongst my colleagues about all the different changes going on in the health insurance industry. So I want to challenge you a little bit about understanding health insurance. First and foremost, health insurance doesn't pay for you to be healthy, just like life insurance doesn't pay for you to be alive, right? And as the insurance companies increase their profits, they decrease what they pay different providers. And if you've ever had a hospitalization, you certainly have seen what the hospital charges and what the insurance company will pay. Well, that's no different when you go to a private provider, whether it's a chiropractor, a physical therapist, a medical doctor, whatever. What I challenge you to think about when you call a chiropractor's office and you say, I want to know if you take my insurance, think about the doctors who do take those insurances. They have agreed to take a fee that's way, way less than what they actually charge. Why would somebody be willing to take a fee way less than what they actually charge? Is what they actually charge a legitimate fee for them to do business in their practice? That's a question you need to ask. The second question you need to ask is, if you see a provider and they don't charge you your responsibility, that being your co-insurance, the percentage you're responsible for, your co-pay, if you have a fixed set dollar value per visit, and your deductible. In the state of New Jersey, that's outright illegal to not charge the patient their responsibility. That is breach of your insurance contract. You are the insured. You have a contract with your insurance company. And should the insurance company decide to look into it, guess what happens? Guess who broke the contract? You. Also, if the provider participates in your network and they don't charge, they have breached their contract with the insurance company. So we've broken two laws when you don't pay anything to go see a provider, whether it's a chiropractor, physical therapist, your medical doctor, etc. So you got to think about this. If they're willing to take a lesser fee, why don't they just charge that lesser fee? What is that about? Why do they charge a fee way up here, knowing full well the insurance company is only going to pay down here? And why do they accept that lower fee? Is it because they add on a bunch of things to your bill so that they can make up some of that loss? Do you really need all that stuff when you go to a provider? These are the questions you need to ask. If somebody chooses to be out of network, a provider, I'm going to tell you my rationale. I'm out of network with every insurance company because I don't want an insurance company getting in the business of me taking care of you. Okay? I understand that when you have health insurance, you want it to pay for your care, and I would prefer that someone else pay for your care, but somebody has to pay for your care. Somebody has to help me keep my lights on so I can deliver the goods and help the families in our community. So I don't agree to reducing my fee structure based on what an insurance company is going to dictate to me, because their fee structures don't even allow me to keep my lights on. I'm not going to pad my bill so that I can keep my lights on. And then I'm not going to break your insurance contract between you and your insurance company by saying, oh, you don't have to pay me. That's illegal. I value my profession. I value my license. And I plan on working a really long time, and that is not something I'm willing to do. So if you want to see a provider who's going to accept a lesser fee, you need to question, why does that provider take a lesser fee? I opted out when they started reducing the reimbursement to the chiropractor because it was ridiculous. You cannot keep your lights on and pay support staff, if you have support staff, with the rates that many of these insurance companies have negotiated for you as a chiropractor to accept. So I don't play in their sandbox because it doesn't make sense to me to struggle to keep my lights on when I can have a more fair and reasonable fee and not deal with submitting the paperwork and the questions and the denials. And you guys all see that when you get your bills in from the hospital and your healthcare providers. So today's topic is about health insurance. Is it really health insurance? I'm here to tell you it's not. Providers who accept it, do they really care about you, or do they care about the insurance company paying them so that they can get more money from the insurance company? In essence, they are not. Hence, they have to see a lot more people, which means you get less quality provider time. And many providers are stepping out of the insurance industry because they don't want to be dictated to on how they take care of you. Because you deserve the very best care possible that that provider can deliver. And in my office, you're absolutely going to get that. So this is Dr. Anita from Mylan Family Chiropractic Center, right here in Bayville, New Jersey. You've been riding in the car with the Chiro. I hope you have a great day. Hi, Nancy. Thanks for joining me. I'll see you on the next ride.